a chronic limb ischemia. Is it clear? Now, except the patient has any osteoarthritis, the differential diagnosis for that is that the patient may have an osteoarthritis of the hip joint. Is it clear? So, except the patient has a osteoarthritis, you may think of a chronic limb ischemia when you have a crampy pain at the level of the lower limbs. Now, after having that excruciating pain, you now descend the legs. You make the patient to be seated with the legs falling down. Is it clear? When you are going to have descent of the leg, you are going to be reperfusion of the leg, and then the leg is going to become erythematous. Is it clear? Erythematous. When you have a reperfusion of the leg and then the leg becomes erythematous, that is called a positive Berger test. Is it clear? In positive Berger test consists of the critical angle measurement, which is going to be less than 90 degrees, and then you ask the patient to sit up to put the limb underneath the body of the patient, and then the foot is going to become erythematous. That is going to show you a positive Berger test, and there's also going to be tingling sensation at the level of the limbs. That's the positive Berger test. Now, after the positive Berger test, the next thing that you have to evaluate also, you have the ankle brachial index. Is it clear? How do you measure the ankle brachial index? So the patient should be in a seated position. You come in the seated position, you take the curve of the sphygmomanometer. Now, when you take the curve of the sphygmomanometer, you don't measure the blood pressure of the upper limb. What you do is that you pump the curve. You pump the curve of the sphygmomanometer until you don't feel the radial pulse. Is it clear? You pump the curve of the sphygmomanometer until you don't feel the radial pulse. That blood pressure, when you pump the curve of the radial manometer, when you don't feel, it's a brachial systolic blood pressure. It's going to be brachial systolic blood pressure. Is it clear? Now you go to the lower limb. You place also the curve at the level of the thigh, and then you palpate at the level of the. You place at the level of the thigh or place at the level of the leg. Is it clear? And then you palpate at the level of the ankle. So generally you place at the level of the leg. You palpate at the level of the ankle. When you palpate, you put the pressure at the level of the cuff. Is it clear? When you put the pressure at the level of the cuff and then you don't feel the ankle pressure, that one is going to the measurement at that level is going to be the ankle systolic blood pressure. Now, to measure the ankle brachial index, you take the ankle systolic blood pressure divided by the brachial systolic blood pressure. Is it clear? Normally, it has to be greater than or equals to 1. Is it clear? But now, there are certain cases when you have 0.5 to 1, it means that you are going to have a mild ischemia. You have mild ischemia. When you have 0.3 to 0.5, it is moderate ischemia, and when it is less than 0.3, it is severe ischemia, and that is called critical limb ischemia. Is it clear? When you have a critical limb ischemia, and you need to know that what the critical limb ischemia is a patient that has ischemia until he starts having rest pain of the distal part at the rest, ischemic pain at the rest. That's called critical limb ischemia. And based on the Fontaine classification, the critical limb ischemia starts as from the Fontaine 3 and the Fontaine 4. Is it clear? And also based on the arterial, the acute limb ischemia, every time you have a total acute limb ischemia, it's also going to be a critical limb ischemia. Is it clear? So those are certain tests that you need to do in order to evaluate. Now, other tests, we have said that you have to palpate for the pulses. Other tests that you have to do also is to auscultation. Is it clear? Auscultation. Auscultation is extremely important with palpation of the pulses. Is it clear? When you palpate the pulses in limb ischemia, you have pulselessness or you have reduced pulses. When you palpate the pulses, you may have pulselessness and reduced pulses, and you may feel for paresthesia, abnormal sensation of the limbs. You touch the patient and you feel as if you are hitting him. You have allodynia, abnormal sensation. So all that is going to be based on palpation. Now, auscultation, there are two things you auscultate. You auscultate centrally and you auscultate also peripherally. You auscultate centrally to find any heart pathology like heart failure that you're going to hear for gallop sounds, S3 and S4 gallop sounds, which is going to tell you that there's a heart failure, which may be the one promoting the heart failure, may be the one promoting the thromboembolization. You may have irregular heart sounds in the case of atrial fibrillation, and it may be the one promoting the thrombus formation. So those are the different cases that you can have centrally. Now, peripherally, you auscultate at the level of the arterial distributions. You auscultate at the level of arterial distribution. Like if you have an ulcer at the level of the foot, you can auscultate the popliteal artery. Is it clear? You can auscultate the popliteal artery to find if there are bruits. Is it clear? Bruits are just like murmurs which are being heard at the level of arteries. Is it clear? Bruits are just like murmurs which are being heard at the level of arteries. If you hear a murmur at the level of the artery, it is much more a brute sound. Is it clear? So it's going to be you heard like shh, 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 shh. Is it clear? So that is how you hear brute sounds for arteries. So generally, those are the different things that you have to do in order to understand the clinical presentation for a patient that has arterial ulcer. Now, after having arterial ulcers in front of you, generally after evaluating a patient and then you find that the patient is having an ulcer, is it clear? You say to put a diagnosis is that you need just to say that the patient has an ulcer. So for the diagnosis, you need to say that the patient has an ulcer, and after evaluating all those arterial obliteration, you say the ulcer is of arterial. It's an arterial ulcer. Now you need to know that when you say that the ulcer is arterial ulcer, they will wait upon that you have to describe on which arterial ulcer it is. Is it clear? Is it an acute limb ischemia or is it a chronic limb ischemia? So those are the two major arterial ulcers that you have to describe. Is it clear? And if it's a chronic limb ischemia, you have to speak about the Fontaine classification of the ulcer. Is it clear? If it's acute limb ischemia, they are waiting that there is no Fontaine classification here. So those are the different elements that you have to bring out in your diagnosis of ulcer. So after diagnosing the acute ulcer, arterial ulcer, you now need to go down to the investigations of arterial ulcers. So now the next tutorial we're going to see now investigation of arterial ulcers.